And then our featured guest is Dr. Meena Singh, and she is a board-certified dermatologist and dermatologic surgeon. She attended Harvard Medical School and trained at the Mayo Clinic. She specializes in ethnic skin and hair and is an expert in hair restoration surgery. She has been featured on the radio, on TV, radio, magazines, and journals, and was featured on the cover of New York Times. She practices at KMC Dermatology in Shawnee, Kansas. God bless you both. And to our listeners, if you have a question to ask of either Reverend Taylor or Dr. Singh, the number is area code 816-576-7400. Area code 816-576-7400 if you want to call, make a comment or ask a question. Now, Dr. Singh, you want to tell us the information you might like to share with our guests, with our listeners?
Sure, absolutely. So I deal in everything hair, skin, and nails. Mm-hmm. So that covers a lot. In the African American community, the most common reasons that we seek out dermatologic care would be for hair loss, for acne, eczema, discoloration, and we even get skin cancers. So I'm willing to speak about any of those subjects, whatever you might find interesting.
Any of them?
Sure.
So wherever you'd like.
Sure, absolutely. So we can start with hair loss. That is one of the main things that I decided to do. When I was in residency, I realized that was one of the main reasons that African American women see dermatologists. And I also realized that the type of hair loss that's more common in African American women is completely different than our Caucasian counterparts. Mm-hmm. In Caucasian women and Asian and other ethnicities,
they lose hair too.
Yeah, they lose hair, but it's from, after you have a baby, which is called telogenifluemia, which is excessive shedding, or female pattern hair loss, which is genetic thinning. And so these are things that you can't help. These are things that just happen.
At a certain age, the hair gets thinner too, doesn't it?
Absolutely. In African American women, however, the types of hair loss that that happen to us, we almost do to ourselves, and it's due to our hairstyling practices. Mm-hmm. In fact, some of our hairstyling practices can actually harm our health. So one of the—
You want to tell what they are?
Absolutely. So I'll start with the first type of hair loss, which is called traction alopecia, which is basically from really tight hairstyles. Mm-hmm. And that is thinning at the temples that we have just from really tight hairstyling practices. And that's very, very preventable. That type of hair loss is unfortunate because you can have permanent hair loss. You can lose your entire hairline, which is an area that frames our face, and that's how we present ourselves to the world. So that can truly affect us. You can see this in celebrities as well, but they hide it, and we hide it as well. These tight hairstyling practices are not the kinds that technically affect our health. However, having had a relaxer has been shown to actually affect our health. Women, African American women who have used relaxers are at higher risk of having fibroids. So these are tumors in our uterus.
Is that right?
Yes.
Of course, I don't have a relaxer. I don't press my hair either.
I had a a lot of us here in the Midwest, I had a relaxer growing up, but I cut all my hair off.
I never had a relaxer because I can't, because of the way the color I wear my hair.
Right.
So if I put a relaxer on, I wouldn't have any hair at all.
Not with the bleach and the Prozac. Actually, speaking of hair dyes, women who get their hair dyed, not bleached, but with true dye, more than, I think, every 3 or 4 weeks, have a higher risk of bladder cancer.
Why would they get it tinted every 3 or 4 weeks?
People get grays, and they want to mask it. So they have a higher risk of bladder cancer. There's another type of hair loss. It's a scarring type of hair loss that almost exclusively occurs in African American women. It is extremely cosmetically disfiguring, and unfortunately, I have hundreds of patients with this particular entity. And I'm only one doctor here in Kansas City. It's not the largest community.
Yeah.
And, I've only been here for about a year.
Yes.
So for me to have already had 100 patients with this entity means that at this point for African American women, it's an epidemic. It can occur to up to 30% of us. So this is a scarring type of alopecia. We think it's associated with having had a relaxer, having had a tight hairstyling practice like braids, weaves, extensions. And what happens, it starts with tenderness at the crown of the scalp. Where it's tender, the hair starts to break off. And then you start to lose the hair. And then that hair loss spreads in a centrifugal way outwards. and then you get scarring and you have no hair there. So it occurs over a number of years, but the reason why no one's ever seen it is because we do such a great job of covering it up. You know, we're so quick in our culture to throw on a wig or a weave or something to mask it instead of addressing it. And also, a lot of our stylists don't have the knowledge about this entity. This particular one I'm very passionate about because it literally affects someone's well-being. Because could you imagine being a woman and having no hair in a way that it could have been prevented, it could have been treated if it had been dressed earlier? So this type I like to do a lot of education about, and I always will go out and speak to stylists. I go to hair shows and try to speak out about this and really educate people, especially stylists, because they're kind of like my primary care provider. They're the first ones to see a lot of these things. And let them know that this is an epidemic in our community. It's something that actually can harm you, and it affects who you are, because that's how we present ourselves.
You know, actually, I see a lady, and she's an attractive lady. She's a professor now, I think, in North Carolina. And she's on TV. But I noticed her hairline because she wears these little micro mini braids.
Right.
And I always wonder why she wears her hair tight like that, because the hairline is just receding.
Yep, exactly.
You know who I'm referring to?
I don't know the woman, but this is the common problem. And you know how we used to get reprimanded for being tight-headed or tender-headed? You know, God forbid you're tender-headed. You know, I would get spanked. Sorry, Mom.
Spanked for being what?
Tender-headed. And this is a sign, the tenderness, the pain, sometimes you get crusting, sometimes you can get bleeding, sometimes you get pimples. This is a sign of excessive tension on the hair follicles, and that you are at risk of actually having your hair to fall out. Once it falls out, it is reversible if you seek treatment early enough and if you stop these hairstyling practices. However, if it continues to occur, it will become permanent.
Is it that, you know, I heard a lot of ladies where they would say when they get their hair braided, that when they take their braids down, their hair has grown. Is that?
Okay, so you're speaking about protective hairstyles, and I'm a huge fan of protective hairstyling. So what you're referring to is a way to prevent breakage. Okay? There are ways to wear braids, weaves, twists, locks in a way that's not harmful. And it's all about preventing tension. So the tighter the hairstyle, and like I said, if you have these symptoms, pain, bleeding, pimples, crusting, that means it's too tight. There are beautiful ways to wear braids and do a protective hairstyle, let your hair grow out. So also the thing that you just mentioned with the breakage, with our type of hair, our hair is completely different than other ethnicities.
All of us have different hair.
We all have different hair. However,
I mean, you can be in one family.
Yep, that's right.
One family, and since we're black, mine might be different from yours.
Absolutely.
And yours is different from both of us. You know, and we don't all have the same texture.
We don't. However, African Americans are more likely to have kinky curly types of hair. Wherever our hair coils and kinks, those are weak points in our hair. In addition, we're the only group of individuals, we're the only population that has these single strand knots, where our hair literally curls upon itself and forms a knot. No other ethnicity has that. Those knots are points of breakage. Some people have so many knots in their hair that whenever they comb their hair, they're literally giving themselves a haircut. So this is why in our community, sometimes we feel like our hair doesn't grow. Our hair grows at the exact same rate and has the exact same amino acid and lipid content as other ethnicities. However, we have these weak points in our hair, and that every time we're manipulating or grooming it, we're giving ourselves a haircut, and so it doesn't appear to grow as long. So what you mentioned was the protective hairstyles, and that's a way to prevent cutting your hair by your grooming practice.
Okay. Because I believe after a certain age, the way I did for me, after I got a certain age, I wasn't going to wear my hair down past my bra and bumper. I cut it because I was getting older, so I try to keep my hair trimmed. And keep it cut a certain style. Because I think it does look nice to a person my age.
Yeah.
And having hair hanging me down here.
You can do it.
I'm trying to do that.
But you have the face for short hair, so it's nice.
Well, it's kind of you to say that. But it's just,
of course.
I feel as though I don't want to wear my hair long anymore. I wore it long for years and years and years. And when my husband never did like for me to have my hair cut. He had a tizzy. I remember once he came home and I had a friend of his who lived in Kansas named Harvey Ramsey. And I asked Harvey to come and cut my hair. But I did have a picture of how I wanted him to cut it up to here, to my shoulders. And what he did was cut it in the back up to my neckline. And when I came home and asked him, what have you done to your hair? And that night he said, there's nothing to grab on to.
Careful.
That's right.
but it'll go back, so I let it go back, and then I didn't cut it anymore for many years.
All right. I want to ask about the, we see commonly where hair falls out in women and men.
Yeah.
And the head is that due to the hair practice or age?
Well, with more time, more things occur. But you're referring to male pattern balding or male pattern hair loss. The medical term is androgenetic alopecia. It is caused by a number of factors. The majority of it is genetic. If you had a twin who had balding, then you're 88% likely to also have it. So clearly there are other factors that could also contribute to it, and that would be systemic and environmental as well, such as, maybe you've been sick and maybe you've had a lot of shedding. If you've had a massive shed, for example, if you had a baby, something like that, or a massive stressor, that can unmask male and female pattern hair loss a lot faster. So what happens is with each hair cycle, and our hair cycles are very long, right? So that's how you get long hair. Each hair cycle lasts about 4 to 6 years. So with each hair cycle, the diameter or the width of each hair shaft gets thinner and thinner and thinner until it finally falls out. That process is called miniaturization. Once it finally falls out, you can restore that hair if you actually treat it. However, after a while, it will become permanent. So the ways to prevent this from occurring, so all types of hair loss are actually treatable. And I feel like a lot of people don't actually realize that, because a lot of men walk around, with thinnings, which is normal. It's considered a normal variant of aging. However, if it does bother you, you can easily treat and address that. So there are topical oral treatments, and there are laser treatments, and there's also surgery. So the surgery would be hair transplantation.
Is that like this man that you see advertised on TV? And these people they show, and like one man says, and this is my own hair, and I can do whatever I want to with it.
That's right.
Now, is that a surgical procedure?
That's hair transplantation or hair restoration surgery. So basically what we do is take hair from an area that we know most people don't thin. So if you look at truly bald men that have very little hair, you see the strip of hair in the back of their head, right?
They always have that.
That's called the safe area, because most people, they hold on to that hair, even if you're balding. So we'll take hair from that area
and put it up in the top.
Add it up and put it in the top, and it grows just like it would in the back.
So now, do we use a needle?
We use a tiny, tiny little needle, the same diameter as, when you get your blood drawn. Yeah. And you're not like holding pressure for the rest of the night. It heals on its own. And so it's very, very small incisions that we make. And so it heals overnight, actually.
Now, when I saw one day, last week, I think, and I think they said, if you call and get information, they'll be given $250 or something like that. I thought, well, it must cost an awful lot if they're going to give you $250.
Right, if the discount is already in the hundreds, how much it costs? It's just like any cosmetic procedure. Unfortunately, it's not covered by insurance, so usually it's in the thousands to get it done.
Right?
Yeah, but if you just want to hold on to the hair that you have and you've started to thin, even if you're a male or female, like I said, there's topical medications, there's oral medications. Topically, minoxidil or Rogaine works very well in about 88 to 90% of individuals. It holds on to the hair that you have. And it slows down the progression of the hair loss. This is a chronic condition. So at this time, there is no cure for it. I do feel like there will be. There's a lot of new studies and not a lot of new clinical trials coming out. But because there's no cure, it's just like having high blood pressure. There's no cure for high blood pressure. You just manage it every day. It's the same thing with these types of genetic hair losses. You just manage it every day.
Are you familiar with the product called African Pride? And it's
herbal. So. Yeah.
It has mantle grow, and it has a lot of herbs in it. And I just wondered how putting that on, because I use it on my scalp.
Sure.
What do you think about that?
So in general,
it's herb.
There are a lot of products out there that have been said to help stimulate hair growth and enhance the length of your hair.
And just keeping the hair healthy.
Right. And so anything that doesn't harm you, I say go ahead and try it. I usually tend to only recommend things that have large clinical trials and have evidence that it actually works, because I would hate to recommend to someone to spend money on something and hasn't been shown to work. There are so many things out there anecdotally, like pills, multivitamins, certain things that, yeah, it could work for you, but unless it's been shown in large studies to work for, a large population of people, I generally won't recommend it. I just say try it. If it doesn't harm you, try it. But at least do the things that are shown to work, because then you're not going backwards and you're not.
Now, are there certain medicines that might make people lose their hair?
Absolutely.
Well, blood pressure medicine.
Yeah, a lot of medications, and they don't cause male or female pattern balding. What they cause is excessive shedding. Okay, and so if you have excessive shedding, like I said earlier, you can further unmask a type of hair loss that you already have. But the most common kinds are birth control pills, anything that affects, your system and kind of shocks your system. So yeah, blood pressure medications, seizure medications, certain antibiotics. Any change in medication actually can cause excessive shedding. And change in hormones as well. So having had a thyroid abnormality or iron deficiency can cause excessive shedding as well.
Now, what about the vitamins that'll make the hair grow?
Okay, so most people will ask me about biotin because that's the most well-studied vitamin that people will say can possibly help your hair grow. And these huge, large population studies...
You want to spell that B-I-O-T-I-N?
Oh, sure. Yep, B-I-O-T-I-N. So in these large population studies, there's a shift towards it possibly helping, but it doesn't have any statistical significance. What it has been shown to do is definitely strengthen your nails. And because it doesn't harm you, and you could be someone that could actually benefit from it, I say go ahead and try it. But don't not do the things that have also been shown to work. So the minoxidil, the Rogaine is one thing. It's a topical formulation. It comes in liquid solution as well as the foam or mousse. Then there's Propecia or finasteride. That's a pill. It was actually discovered because it was used to shrink a man's prostate, and all these men were getting their hair to grow back. And so then they actually did these clinical trials to get their hair to grow back, and then they realized that it can be used for hair loss as well.
Now, is there something that we can do that, like graying? Is that something that you do to help without?
That's natural.
There's a lot of new studies actually out right now talking about the graying effects of hairs. We know it's definitely due to a certain antioxidant effect on the hair. There's no actual treatment for it right now. However, I will be going to an International Society for Hair Restoration Surgery meeting in Malaysia in a couple weeks, and one of the big topics is a cure for gray hair possibly, and the biology behind it. So I will get back to you on that.
Because I'd like for mine to gray like that.
I know, he has, for the listening audience, a beautiful silver hair. It's not gray, it's silver, and it's shiny, and it's
if mine would do like
boisterous.
I wouldn't put this on it. I would make me at my age, and I'm old to be his mother, and my hair won't gray like a lot of people's hair.
No, I'm starting to gray, unfortunately, and it's not cute. It's the kinky grays that come out the side of my hair. But I think it gives me character, unless I've been through some stuff.
Yeah. See, and I want mine to turn like that.
Oh yeah.
I'm not that old. I'm still a young man.
How old is young in your opinion?
55.
55.
That's 6.
See, I'm going to be his mother. And my hair would do like that. I would never.
That's beautiful.
I've had gray hair for at least 10 years.
Wow. Oh, and you started having premature gray.
Early.
Why would you, now tell me, why do some people gray prematurely and then some just don't at all?
It has a genetic predisposition, but we also talked about environmental and systemic factors.
Okay.
Some people go through stressors and it increases the rate of graying, as well as, like I said, there's an antioxidant factor to it. Some will say that if you do things like take wheatgrass and other things that are antioxidants, that it decreases the rate of graying, but that hasn't been shown in large studies. This is just, kind of wives' tales anecdotally. But, go ahead.
A lot of mine is, I guess you would say generic, because a lot of folk in my family have gray hair and that are young.